Hi, everybody. This week we are going to talk about lymphedema, and that is a condition that is actually kind of common after breast cancer, which is why we're talking about it during Breast Cancer Awareness Month, because this is managed by physical therapists who are specialty trained in order to be able to manage this condition because it's what we consider non-curable or something that does require long-term management in order to keep the swelling, which is what this is, a swelling condition, under control. Right. So it's nothing to be scared about, but it is something to have some knowledge about and to be a little bit more sensitive to the people in our environment that may or may not be affected. Or if you are affected, maybe you can learn a little bit of something. So, lymphedema is a condition that is swelling that results from the lymphatic system being underperforming for what it should be able to do, right? Why that happens, we'll talk about it in just a minute. But first, what is the lymphatic system? If we talk about something that goes wrong with the system, sometimes it's better to understand first what that system actually is or what it does. So the lymphatic system is just a series of vessels throughout our body, just like we have arteries and veins, right? But the lymphatic system works alongside the venous system to return fluid back to your heart. Now, veins only pick up a little bit of stuff, really like that carbon dioxide, which is quite clean and is a byproduct of a muscle contraction. So that's what the vein will pick up. Everything else, all the other cellular debris in our body, is picked up via the lymphatic system. So that's important because since that's kind of all the yuck in the body is getting picked up by the system and bringing all this fluid back to the heart, the lymphatic system has to be cleaned. And so therefore you need lymph nodes, which is where the cleaning occurs in order to be able to safely return that fluid back to the heart so that our circulatory system keeps on functioning. So lymph nodes, therefore, may be removed, if not multiple nodes removed, during breast cancer related intervention. And so the minute that you remove lymph nodes, that's where we can start to see a little bit of an issue with how that system is actually functioning. So when we talk about breast cancer, it is super common that what they'll do is they will remove one, if not a couple of the lymph nodes in order to be able to understand if the breast cancer has remained in the breast itself or if it has left the breast and has now started to progress. And so they have to do this testing to understand the severity and progression. So you have to do this in order to know what you're dealing with breast cancer. Once that happens, though, and we remove lymph nodes, then we can start to get that lymphatic system in a stress state. All right. Now, why? Why would that stress them out? Well, if you think about a highway and we've got toll booths on the highway, so every lane of traffic, think of that as a lymphatic vessel. So every lane has to go through a toll booth. No ifs, ands, or buts. You have to. What if they close some of those toll booths, right? Now the traffic starts to back up because there's less toll booths to go through. So that's essentially what happens when we start removing lymph nodes, is that sometimes it's like it's still adequate and they can still what's left is fine to be able to keep that flow of traffic without anything backing up. But what can happen is that it's not. And because of the decreased amount of lymph nodes, then you can start to see a backup in that traffic when that backup in the traffic with breast cancer goes typically into the arm or into the breast. And that's swelling. It's just extra fluid. That's all it is. And this is an example of what could happen, right? We've got one arm that's much larger than the other, and that's just because of the backup of fluid. So that's kind of what you would see. That's a pretty significant case. Most of the time that we'll catch it as much smaller than that, but this is common as well. And what happens with this condition, right? So fluid backs up. Why do I care? Well, we care because the fluid, when it backs up, oftentimes if we elevate the limb, it'll drain, right? And then it's not so big, right? Or I'll lie down at night and my arm's not down against gravity all day. And then I lie down at night and it's like, oh, like it's not swollen in the morning, but in the evening it is. That's weird. So that's in that earlier stage of lymphedema. Well, that starts to progress. And so now what you experience at the end of the day becomes what you start your day with. And then it just remains. And so that's how it progresses. And then that fluid that was kind of soft and movable starts to become fibrotic. And so the stages of lymphedema means that it doesn't just stay where it is. It usually progressively gets worse when it's not managed. Just like anything, right? If we don't manage diabetes, it gets worse. If we don't manage osteoarthritis, it just gets worse. It follows the same line as anything else. It just means management, okay? Now, how is it diagnosed? Well, there's studies that they can do where they kind of inject some dyes and look at the rate of flow within the lymphatic system, or we can do some pretty non-invasive things in the clinic where I take tape measurements and I measure for every 4 centimeters up the arm, and we use a formula to calculate a volume of the limb, and we compare that to the other side. And there's other things that we're looking for is like what we call pitting. So if you press into your arm and the indent stays, that's called pitting. That means that's indicative of swelling that's there. Stemmer signs where we'll do like a pinch the skin and lift and see if it stays pinched up, it should just kind of fall back down. It shouldn't stay lifted. And then fibrosis is when it feels hard, right? It's like, it's not squishy anymore. It doesn't feel like muscle. It's just firm to the touch. That's fibrosis. And so these are all different ways that we're like, yeah, this is definitely what's going on. This does look like it's a swelling situation, or edema means swelling. Now, why is it important to attend prehab? And this might be somebody that you know that's newly diagnosed with breast cancer, and understanding what can we do ahead of time to know how can I decrease that stress on my lymphatic system, knowing that I have all of these different procedures, whether it's surgery, you may or may not have, you'll have some lymph node removal, but is it a full lymph node dissection? There could be reconstruction, no reconstruction, implants, no implants, radiation, chemotherapy, like all sorts of things that can happen in order to treat the cancer. So, but what can you be doing proactively to prepare your body to be able to withstand all of that and with the least amount of repercussions later? And so that's prehab. So it's an understanding of, let's understand what your baseline is before you go through all of this. And then let's kind of help prepare your body so that we're going to give it the help that it needs when it's in a stress state. And so that's, and establishing that relationship with a therapist so that you have a familiar face to see after you've had surgery. Or chemo or radiation or whatever it might be, so that you have developed some rapport. So just having some proactive visits can be quite helpful for being able to get the limb volume measurements, kind of understand, do we already have a little bit of a difference in one side of the arm, one arm compared to the other because of dominance, muscle dominance. And then, what are the simple things that we can do to be very proactive right after surgery, and think about how can we get that post-operative swelling in addition to lymph node removal to be the least amount of stress on your system, so that we don't overwhelm something that already is needs to heal pretty much. So that's prehab, and that's all that means, and I think it's important to talk about. Now, how can physical therapy help with lymphedema? We've talked about what it is. We've talked about why it happens after breast cancer, but what do we even do about it? I mean, that's a fair question. So what we do is we have 2 stages that we typically do in treatment. We have one stage where we try and get the size of the limb smaller if it's, actively swollen. So that's called the decongestion stage of treatment. So we need to get it smaller. How we do that is with compression. So we might do compression bandaging, or we might do a Velcro style garment. That's an alternative that is, for different reasons, we'll use that alternative. And we always kind of leave it up to the patient as well. Here's the pros, here's the cons, what's going to work best with your lifestyle. The other things that we do are techniques called manual lymph drainage, which is a soft tissue technique that we use to increase what we call the lymph angio genesis. So it's just how quickly is that lymphatic vessel pumping, and so we can use this to help get that lymphatic system moving a little bit for a duration of time. And then skincare is really important, and exercise. Movement is great for circulation. So all of those are what we do in the decongestion phase. And then we transition that into the maintenance phase, which is how do we keep it smaller? So once we got it smaller, now we keep it smaller. And so that includes typically some form of compression for daytime, maybe nighttime, maybe a pump, maybe not a pump. It just kind of depends on severity, maybe a glove, maybe no glove. So it all just kind of depends on the person, but then continued movement, continued exercise, because movement helps with circulation, and then continued skincare. So that's what we do. And we just really trying to get people as independent as possible with managing their condition. Now, long-term management is always the goal, which means you're out there doing everything that you want to do. Like lymphedema doesn't stop you from doing anything. It doesn't mean that you can't raise your arm because it's painful. It isn't that. Lymphedema is typically non-painful. It's just some swelling. It's not inflammation. So those are different. So you can work out, you can do a dragon boating team, you can run, you can do anything that you want to do. Lymphedema should not be what's stopping you from living that active lifestyle. So if anybody has questions and they're like, oh, that's still a big word that I can't quite wrap my head around, like feel free, like check out our website. We've got a page on the website that talks about lymphedema itself, and you can give us a call at the clinic. If anybody might like need help to, managing it, you can always come in, call the clinic. We're happy to help, or shoot me an email. Okay. So that is that, everybody. I appreciate everybody staying tuned for what's going to be coming up next week.